The Affordable Health Care Act has been law for more than a year now, and some of the mandates in it are already in effect, like expanding coverage to dependent children up to the age of 26 and expanding benefits for preventive services. Other mandates will kick in by 2014, such as the most controversial requirement that everyone enroll in a private health insurance plan or pay a penalty. The so-called individual mandate, which the Supreme Court upheld in its decision today, saying that the individual mandate was authorized by Congress's power to impose taxes. Jerry Crisostomo is the plan administrator for Netcare.
We believe we need the mandate to survive as local health insurance companies because you don't have any new businesses coming in, new revenues coming in as a result of any mandate like you would in the 50 states.
So if the individual mandate applies, you do have new customers coming in.
We have new customers and everybody will be required to buy insurance. So it's good for the insurance companies. On the other side, the Guam consumers now have to comply with this mandate if it does apply here. And if they don't, they have to pay a penalty, which is a tax.
Still, there's been some question about whether that individual mandate would apply to Guam because the Health Act did not mention the territories. But since the High Court has now decided that the mandate is a tax and Guam mirrors the federal tax code, it should apply. But Crisostomo says it's not all clear yet.
If it does apply, assuming that it does apply, where does the money come from for those premiums? Is it the federal government if they take over the exchange? Is it the local government if they establish an exchange? So all of those, I think, those issues need to be clarified.
A significant number of the areas of the law are quite good. There's no question about it, But as far as cost containment, none of the areas that have been put into place contain costs.
Select Care Administrator Frank Campillo is concerned about one mandate in particular that requires local governments to subsidize health insurance premiums for those whose incomes fall below the poverty line.
A significant number of the population in our island will qualify for those subsidies. There hasn't been a quantification of that, but it's going to be clearly in the millions. In my mind, I will put it past $10 million.
So you are concerned that this may raise costs for everyone?
Well, I'm concerned that the island of Guam will not have the ability to pay for the subsidies.
However, the legislature's Health Committee Chair, Senator Dennis Rodriguez, points out that Obamacare also mandates the return of premiums in excess of 80% of an insurer's medical loss ratio, and it provides Guam with more Medicaid funding as well.
These were very important to me, parts of the law that I knew would benefit Guam, and so now that it is upheld, we know that this will continue to happen.
So you're hopeful that in the long run it will save money, not cost us more?
Absolutely, and that's the whole intent, is to save money and to ensure that every person on Guam has access to health care.
We don't see how insurance cost is going to be reduced with Obamacare. We're required to cover all pre-existing conditions for adults. Beginning in 2014, we have to cover all pre-existing conditions for adults regardless. We cover that now for dependents under the age of 19. We cover dependents up to age 26. We have to give back a rebate if we don't spend the premiums, 80% of the premiums or 85% of the premiums on claims. So how does a politician think that we're going to save money?
Senator Rodriguez has called a public forum for next Tuesday evening, inviting insurers and regulators to help answer the still unanswered questions about Obamacare.
These are concerns that we would have to go through. I've scheduled a forum next week, Tuesday. All these stakeholders have, well, at least all the insurance companies have confirmed their attendance. We've invited public health as well. We've invited the Attorney General as well, because all these legal concerns, legal questions will be out there, and so it's just appropriate that they're involved in this forum.
Kevin Kerrigan, PNC News.